Good afternoon. This is Dr. Acosta. I work at One Community Health in Hood River, Oregon. Today we're going to talk about colon cancer screening. Colon cancer is very common. It is not a rare disease. It's the third most common cause of cancer death in the United States. Fortunately, we have a few methods of detecting cancer early. Screening tests for colorectal cancer. The most simple one, that we do two in this community real common. The most simple one is looking for occult blood or hidden blood in your stool sample. This is done at home, in the privacy of your home. It's a very simple test. You take a tiny little sample, you stick it in this little tube, and you send it off in the mail. You do that every year. And if it's negative, you do it again the next year. If it's positive, you'll need a diagnostic test like a colonoscopy. Now, colonoscopy can also be done as the first test. You can do that on everybody, colonoscopy. And that's a procedure where you'll go to the hospital or to a specialized clinic, and you will be given intravenous medicines, and you will be asleep, and you shouldn't feel anything from the colonoscopy. The advantage of colonoscopy is that they can remove polyps and precancerous lesions and actually prevent some forms of cancer. The disadvantage is that it costs a lot more, and it's invasive, and rarely there are complications from colonoscopy. People aged between 45 and 75 years old are candidates for colon cancer screening. Those are the age groups that should do it routinely. But whatever method you choose, you can discuss this with your doctor. You should do some test, and that way it diminishes your chance of dying of colorectal cancer.